Hello, Dr. Silverman. I'm so excited to chat with you today. Thank you so much for taking the time. I am super excited about this. So, for everyone that will watch, I am here with Dr. Silverman, and we are going to dive into the science of sleep and relaxation, which I know a lot of people have questions and have been curious about. So, again, Dr. Silverman, thanks for being here. And before
Of
we jump in,
course.
we have a lot of questions to cover. Can you just share a little bit about who you are and what you do?
Absolutely. Thank you so much for having me. I'm very excited to be here and chat with you. So, I'm actually a clinical health psychologist by training, and then I specialize in an area called behavioral sleep medicine or sleep psychology, which is the non-medication approach to helping people improve their sleep. And so, the majority of patients that I see are typically dealing with insomnia, which looks a little bit different for everybody, but most often it's either having difficulty falling asleep, difficulty staying asleep, so those dreaded like 2, 3 a.m. wake ups,
Yeah.
and then having difficulty falling back asleep, or waking up too early, having poor quality sleep. And so oftentimes it's one of those or a combination of those. And so my approach to helping people improve their sleep is to actually teach them very specific sleep skills that are going to be drug free, non medication, very holistic, and essentially get them to a much better place. So, having much more of a long term solution for their sleep problems. So, the majority of patients that I see do have insomnia, but I also see a lot of other sleep disorders just by nature of the work that I do. So, things like sleep apnea, which is often thought to be a very male centric sleep disorder, but a lot of women have it too, and restless leg syndrome and things of that nature too. So I always try to intervene from more of that non medication perspective. And as far as my practice goes, I see patients virtually. My practice is 100% remote, so I can connect with folks all over the US, depending on where they live and where I'm licensed. But the treatment that I provide, which is called cognitive behavior therapy for insomnia or CBTI, that's my primary specialty. That is something that can be delivered virtually and makes it really easy to get access to science backed sleep care.
I
So
love it.
that's my spiel.
Oh my God, that sounds amazing. And I did not realize what you just mentioned about it being more of a male um, thing. I didn't know that.
Yeah, we often think about like the middle aged to older male who maybe is snoring all the time. You know, if your dad or uncle or grandpa, you hear them snoring in the other room,
Yeah.
right? And we often think like, oh yeah, they're always just snoring, but oftentimes that is actually a very telltale sign that they may actually be not getting enough oxygen while they sleep and could be something like sleep apnea. So it's often thought to be more of a male sleep problem, but what we're starting to discover is that a lot of women actually, and when they get to more of the perimenopause to menopausal years, their risk for developing sleep apnea, because all of the tissues in the back of the throat start to soften, it actually increases tenfold and actually matches the risk of men at that age group. So it's actually becoming a lot more common, although unfortunately it goes undiagnosed and undertreated because it's not something that is yet on every doctor's radar. So that is
Right.
why sometimes it's really helpful to see a sleep specialist who can tease apart what may actually be going on beneath the surface.
Right, and that makes total sense, and that's actually amazing advice to even, for anyone to hear, because if they are dealing with that, now they can just dig a little bit deeper. That's
Yes, I'm
amazing.
all about digging deeper. Yeah, and sometimes you might have to go see a different doctor as
Right.
well.
And right, a lot of people don't like change, but sometimes that's exactly what you need.
Hmm.
Perfect. Yeah, I
Yeah,
love that. Okay, so just diving in. So the
let's do
first
it.
the first topic I want to cover is just basic understanding sleep and relaxation. So What exactly happens in the brain and body when we sleep?
This is such a great question because there's so many misconceptions about sleep. And we used to think that when we put our head on our pillow and fell asleep, that our brain went offline. And that is not the case at all. Our brain is very active while we sleep. And there are a lot of recovery processes that take place depending on which stage of sleep we're in. What I will say is and we can definitely dive into this more, having a wind down routine before bed is really important to promote a sense of relaxation, to really make sure that the mind and body are calm as we transition into sleep. So we really want to set the stage for good quality sleep to happen. And relaxation is such a huge part of how well we might sleep or the overall quality of our sleep, and can really influence how active our brain is during the night, and could potentially, if the brain is very active, lead to wake ups if that is something that somebody is dealing with. The dreaded, as I alluded to a little bit earlier, the dreaded 2 or 3 a.m. wake up and your mind's racing and you can't turn it off and you're thinking about your to-do list and that upcoming trip and all the things. So we really want to ensure that our mind is as calm and relaxed as possible because sleep is such an active process. And sometimes that's easier said than done, but there are, of course, many ways to help set that stage for sleep to happen. So, as far as the different stages of sleep go, again, there are a lot of misconceptions about our sleep stages, but I will give you kind of the quick rundown of each stage of sleep and what typically happens in each stage of sleep. So we have 3 stages of non-REM or non-rapid eye movement sleep.
Okay.
Stage 1 sleep is considered a very light stage of sleep. This is actually such a light stage of sleep. A lot of people feel like they're half awake in this stage. So
Okay.
I like to call it twilight sleep because it's almost like you feel like you're awake, but maybe you look at the clock and you know that maybe an hour or two has passed, so you must have fallen asleep. It's very much that like half awake transitional state, but it still is considered sleep if we were to measure your brain waves. Then non-REM stage 2 sleep is still a light stage of sleep, but it gets a little bit deeper.
Okay.
And then N3 or non-REM stage 3 is what's considered our deep sleep or slow wave sleep. And when people are often thinking about sleep, I often hear that we should be totally unconscious for 8 hours and have 8 hours of blissful deep sleep and not wake up at all. But that's actually very far from the truth. As adults, we actually only need maybe a couple hours of deep sleep, and those hours are typically only happening in the first few hours of our night. So, usually between hour 1 to 3 or 4, give or take.
Okay.
And a lot happens during deep sleep. So, this is very much that restorative sleep where our body is recovering.
Ugh.
This is also where the brain is getting what I like to call a car wash. What we know about deep sleep is it actually helps to clear out toxins from the day.
Okay.
So it's such an important stage of sleep. And all stages of sleep are important, but deep sleep in particular helps to clear out any toxin buildups or things that our brain needs to essentially get out so that it can repair, recover, and just ensure that we have that restorative process for our brain. And then not those are the non-REM stages of sleep, so non-dream sleep. And then we have, of course, REM sleep or rapid eye movement sleep, which is I'd say most people have heard of this, and it's often where we are dreaming. And this is actually a very active stage as well. A lot happens during REM. We, of course, are dreaming, but there is also a lot of memory consolidation and learning consolidation, also a lot of emotion processing. So, when it comes to REM sleep, we also maybe need a couple hours of REM sleep as adults, and typically that stage of sleep is happening the middle to end of our night. So while deep sleep or slow wave sleep is usually the first part, REM sleep is usually the middle to end of our night. And interestingly, the closer we are to our final wake up time, the lighter our sleep typically becomes. So that's also why sometimes if you wake up 30 minutes before your alarm or 30 minutes before you want to be up and you try to fall back asleep, and sometimes it's really hard to fall back asleep, it's usually because you've kind of come out of a very light stage of sleep and it can be hard to transition back. So that is, in a nutshell, our different stages of sleep. And we typically cycle through those stages in order,
Okay.
give or take. Everybody's a little bit different, but generally
That was going to be my
our
question. Is it generally the same for everyone, whether it's good quality or bad quality? It's pretty much those exact same stages,
So most
essentially.
people will go through all of our stages of sleep,
Okay.
whether or not it's good quality sleep versus poor quality sleep. That really, I think, speaks to how long someone might spend in each stage of sleep. So that's going to look different from person to person and even from night to night. There are so many things that can influence how long we might be spending in each stage of sleep. Things like how much natural sunlight we got that day, or what time we ate our meals, what we ate for our meals. Was there any physical activity or movement throughout the day? What happened before bed?
Right.
Things that can really influence how we cycle through our different sleep stages, but more or less, we'll all cycle through those individual stages. And typically, a full sleep cycle is anywhere between 90 to 120 minutes, give or take. And we usually wake up after we complete a full sleep cycle. So, this is also something I always like to share with folks because it's not something that gets talked about enough. The fact that we actually wake up a lot during the night, whether or not we realize it. So, waking up is actually not inherently a problem as long as you can fall back to sleep. It's more so when you wake up and then you're awake for a prolonged period of time that may indicate something like maybe there is more stress or worry in the picture, or maybe there is an actual sleep disorder like insomnia in the picture. But generally, if you wake up, even if you wake up to use the bathroom and you can fall back asleep pretty quickly, not inherently a problem. So waking up is actually not the enemy. We want to embrace a little bit of wakefulness during the night because it is a very normal part of our sleep wake cycle.
Yeah, I think that is really important to know because people do not understand why they are waking up, and just even understanding if you do wake up and you are up for a while, understanding why you could possibly still be awake and trying to wind yourself back down if it is a wired brain at that time. So that's really
Yes.
good to know. I like that. Now, in terms of the 8 hour thing, I know that's something that's, kind of all over the place in terms of, women and men and needing 8 hours versus 6 hours. Why is it that some people do feel more refreshed if they do essentially get 8 hours or 6 hours? Or some people may feel exhausted.
Yeah. Well, this is such a great question. I'm glad you brought this up because sleep is just like shoe size. One size does not fit all. So some people need more than 8 hours, some people need less than 8 hours. And I think there's so much discrepancy out there between how much sleep someone should get because there is actually a very wide range of sleep need across the lifespan. So, what we know from the research on sleep duration is that yes, most often we hear we need 8 hours of sleep. Well, that comes from original data that looked at the average number of hours that people might be getting across their lifespan. And what we know about adults is that anywhere from 7 to 9 hours is about the average. So the middle of that is eight. And that's where that 8 hour comes from. However, it's very much this 8 hour myth. It is not a magic number. It does not mean that everybody needs 8 hours.
Yeah.
And unfortunately, we hear that all the time, even to this day. It gets perpetuated all over social media that we all need 8 hours. And sometimes that can actually backfire if you aren't someone who actually requires 8 hours of sleep. So when we look at the data, what we actually know is there's this very wide range of sleep need. And what I mean by that is really anywhere between 5 to 10 hours could be considered normal.
Mm,
So
okay.
that is a huge range, right? And so what we know is there won't be as many people who need the 5 or 6 hours sleep and the 10, 9, 10 hour sleep. So on the ends of the spectrum, most people are going to fall somewhere in the middle of
Okay.
that range. But anyone who falls within that range, it could be considered a normal or healthy amount of sleep for them. And it's based on genetics. We do know that the total sleep time that someone might get is actually predetermined. So it's kind of set from birth, but that can also change throughout the lifespan depending on so many different factors like age, medical history, if
Okay.
there are any medical conditions in the picture, kids, jobs, responsibilities. I mean, there's so many things that can kind of change or influence how many hours of sleep someone may need in order to feel well rested. So that is why I think some people feel like I can get 6 hours and I feel great. Or where some people are like, no, I need my 8 hours or I feel exhausted. And it's because sleep is so unique to each individual. Everyone is going to feel different based on what their body truly needs. And I think that's important to listen to because if you are someone who needs 8 hours, but you're barely getting by on six, you're losing a lot of sleep over time. And of course, we know, as we hear it all the time, some of those negative health consequences. So it is something to think about whether or not sometimes we can get that number of hours of sleep that we need. It is important to ensure, if possible, that you can get not only enough sleep for what your body needs, which again is going to look different for everybody, but also making sure that that is good quality sleep as well.
Yeah, and I think that's really important. And what really struck me with what you just said, the predetermined, and then that changing as you go through life. So, if you don't mind, just kind of touching on that with the predetermination, how does that
Yeah. Yeah, so, well, this is actually, relatively speaking, very new research in the sleep
work?
community. What we know is that there are certain genes that can influence how long someone may need to sleep. So, what's referred to as your sleep need, not your sleep want, but actually how many hours of sleep your body actually needs in
Okay.
order to function at its best. And so, this is actually, depending on genetics, it is, either going to be on the shorter sleep need or the longer sleep need or somewhere in the middle. And so there are certain genes that can dictate that total sleep need for each individual. And then we also know that our circadian rhythm or our internal body clock can also be influenced by genetics. So that being predetermined as well, where most people will either identify as more of a morning person, more of a night owl, or somewhere in between. So there are certain genes that ultimately influence the sleep requirements that someone may need, but also where someone actually feels their best during the day, whether that's morning, night, or afternoon.
Wow. Okay. Yeah, that makes total sense. That's new, that's brand new to me hearing the predetermination. That's really cool. That's good to know.
Yeah. And of course, genetics are not everything, right? The genetics set the stage, if you will. They load the gun, and then epigenetics pull the trigger, which is more so how our genes interact with
Yep.
our environment and our lifestyle. So things can change. And again, so many things can change what our body needs in order to feel well rested. But I'd say women in particular kind of get the more challenging sleep changes, if you will, hormones being a huge part of that. But generally speaking, as babies, as kids, we need a lot more sleep in general because our brains and bodies are developing. So we need a lot more deep sleep and REM sleep. We need a lot more sleep to make sure that we develop properly. But then as we become adults, we maybe don't need as much of deep sleep or REM sleep. We're still getting those stages of sleep, but we end up spending less time there and needing less sleep overall. And then as we continue on into adulthood and older adulthood, there are some individuals who actually end up sleeping less. Not
Mm.
always the case, but sometimes that does happen, or sometimes rhythms shift. So if you've seen older folks who fall asleep very early in the evening or very much prefer those early dinners. Things kind of shift a little bit earlier in a lot of older folks. So things definitely change depending on our season of life. But it is certainly something that is not only influenced by genetics, but then also our lifestyle and how we generally go about our days. And that includes how much light exposure we get, how much activity we get, our nutrition, and the things that really impact our health overall.
Yeah, that makes total sense, and that is great. It's great advice and insight for, the listeners when they hear this. That'll answer probably a lot of questions that they had.
Yes.
So, kind of switching gears, in terms of aromatherapy, would you say that it has an impact or any kind of influence on relaxation and sleep?
Yes, it absolutely can have a very beneficial impact on setting the stage for sleep. What I will also mention, sleep itself, the actual process of sleep, is not something that any of us can really control.
Mm.
As much as we would like to control when it happens, we ultimately don't. Our brain takes care of that for us. So when we think about aromatherapy or activities or things that promote relaxation, those are very much things that can actually help set the stage for sleep to unfold, meaning they kind of prepare your mind and body for sleep to happen, and they can influence sleep to happen. They can make sleep happen a little bit easier, if
Ah,
you will.
okay.
So, aromatherapy and what has been most studied as far as different scents that can really impact sleep and overall sleep quality. There are actually a lot of scents that have been studied. I was reviewing the literature. I know lavender is the most studied
Yeah.
because it's very calming, but there are a number of other scents. So, for example, eucalyptus, bergamot, sandalwood,
Mm.
jasmine, ylang ylang. Oh, there's so many. And I think what it really comes down to is finding a scent that you love
Yeah.
and that actually promotes relaxation for you. And that actually goes for really any activity. We all prefer certain scents,
Yeah.
and we all prefer certain activities that we want to help promote relaxation. So I think it's finding one or two scents, for example, as part of the aromatherapy that can really promote that sense of calm and relaxation within your own body. And once you find that, then that's kind of your signature scent and can actually, over time, start to become a cue for sleep. Because even though we're humans, we're still animals by nature, if you will, and we learn by sense. We learn by doing, we learn by seeing others do things, right? So we're still learning all the time. And once you start to introduce a new scent or an aromatherapy practice, say as part of your wind down routine before bed, let's say, for example, you love lavender and you choose to use like lavender sachets or essential oils or a lavender blanket, that can start to become a cue for your brain that sleep is about to happen or that sleep will happen soon. So, for many reasons, yes, it can help promote more of a calm mind and body, but it can also really become that cue for sleep before bed, which is exactly what we all want to set the stage for sleep to happen. Because again, we can't actually force it to happen when we want it to, but we can influence it. And I think aromatherapy is such a great way to really influence the process of sleep.
Yeah, and I think so too. I feel that that transition kind of helps. Like when you do have an extremely busy day and your mind is wired and you do get home and you get to, you get relaxed, you get comfortable, and now you start just smelling the smell of lavender and your body's like, oh, yes,
Mm-hmm.
we're starting to relax. We're starting to just be on chill mode, and it just helps
Yeah.
transition instead of trying to say, all right, let's just go from here to here. We got to go to sleep. We got to sleep. We got to sleep. That's when you
Yeah.
start now. You're overthinking, you're forcing, and anything you force never really works. It's not ideal.
Exactly, exactly. And you bring up such a great point because I think for a lot of us, especially women who are juggling so many different responsibilities, we can't be going 90 miles all day long and then just hop into bed at night and expect that sleep is going to happen. I mean, I guess you could argue that you might be so exhausted from the day that kind of crash, right? But that's also not necessarily a great long-term solution. So our
Right.
brain and our body need time to transition from our very busy day to sleep time. And so having a buffer zone where you can engage in something that's relaxing, you can, grab your favorite scent, you can really incorporate aromatherapy or other relaxation practices into what I like to call your buffer zone. It's a
Yeah.
zone between that busy day and your sleep time so that you really protect your sleep time. That's going to make all the difference. And over time, I think what a lot of people realize is the body craves that transition and that time that is dedicated to just promoting a sense of relaxation. It's so important, not just for sleep, but just for our mood
Yeah.
as well.
Oh,
And
yeah.
just to have like a sense of disconnect from the day
Oh, yeah.
because again, easier said than done sometimes, but it is so important for many reasons.
Yeah, I agree. And I think it is widely overlooked. And just if you just take a little time to just take a little time, I think that's really important. And it kind of leads me into now
Yes.
the question of melatonin supplementing. Um, I know this is talked about also very widely. What is your take on it? Do you think it's helpful, or do you think it's kind of like a overhyped a bit?
Generally speaking, it is not going to be helpful if you're dealing with an actual sleep problem like insomnia.
Okay.
So, melatonin is what's considered a body clock regulator. It is
Okay.
actually not a great sleep aid. And unfortunately, it gets marketed as a sleep aid or, great sleep supplement. And for many reasons, it can often backfire for a lot of folks who might be taking over the counter melatonin. And reason being is because the doses are actually incredibly high over the counter.
Okay.
And like many other supplements here in the US, melatonin is not FDA regulated. So a lot of companies will add things to melatonin products that are not actually melatonin. Or they may actually be adding different doses of melatonin than what's marketed on the label. And because there are no regulations around that, you really don't necessarily know what you're getting, not only in terms of quality, but actual purity of the product. You may not actually know what you're taking as a result. So, for a lot of reasons, they can backfire. And typically the doses that we can get, at the grocery store or drugstore are well beyond what our body would actually need in order to see a benefit. So, in my opinion, anything more than 1 milligram is probably too much. And you might see 3, 5, 10 milligrams at the store, which is essentially like flooding your system with all of this
Wow.
excess melatonin. And that's why a lot of people will wake up feeling really groggy, even like that hungover feeling. It can also lead to more irritability and some people even more anxiety. Sometimes it can also lead to very vivid dreams or even nightmares at those high doses. So it can definitely be a little bit tricky as far as figuring out the dose to take as well as when to take it. And because it is not necessarily a great sleep aid, even though a lot of people are taking it as a sleep aid, right? It can, unfortunately, be doing a lot of people a disservice because it really helps our body clock reset. And that isn't often the issue for a lot of folks who are taking it. So, for all of those reasons, what I typically recommend is working with a sleep specialist who can actually help you figure out why you feel like you need to supplement with melatonin in the first place. And to really kind of see, well, what's the reasoning behind why melatonin maybe is in the picture? And sometimes it is just because maybe even another doctor said, try melatonin, and see if that helps. Or maybe a friend or something suggested it, right? So I always like to encourage folks to actually work with a sleep specialist, figure out why supplementation is even a question. Like, let's look beneath the surface and see if melatonin is actually something that is worth taking. So I will say, even though it's not traditionally a great sleep aid for having more insomnia like symptoms, like difficulty falling or staying asleep, it can be helpful for a few select individuals. And for example, folks who are shift workers, working night shift, rotating shifts, or folks who have other circadian rhythm problems. Sometimes it can be helpful for jet lag if you're crossing multiple time zones. So there are certain instances where it may be helpful, but the dosage and the timing of when you take it are key to seeing any benefit. So most people who are taking those large doses right at bedtime probably not doing much for them and usually is unfortunately backfiring, doing folks a disservice, leading to some other potential negative side effects.
Yeah, I was going to ask, could it become, or has it become addictive? Or just,
We're not seeing that in the research, no. I mean, so of the things that are out there, it's probably the least habit forming
okay.
supplement to take when it comes to sleep. But, when we think about melatonin, a lot of people don't realize that it's a hormone. And it's a hormone that our brain releases in response to darkness or dim light.
Mm,
And in our own brains at night, our brains will release very small quantities of melatonin when our brain gets those darkness signals. And that is also why we hear a lot about artificial blue light, because if we're getting all of this screen use, this artificial blue light at night, it can potentially affect how our melatonin production is released into the system because it is a darkness hormone. Our brain needs that darkness signal in order for melatonin to release. So,
okay.
with all that being said, yeah, it is something where it can be helpful in certain individuals who maybe are dealing with a job where they're not on the same sleep schedule as their natural sleep schedule, or in certain instances where circadian rhythm is what's called misaligned and it can help reset. But it is something where I encourage folks to look a little bit deeper before resorting to melatonin.
Okay, yeah, I think that's really good to know because some of those things you mentioned I wasn't aware of. So that's really great to know. In terms of things that do work, um, essentially sleep hacks, what would you recommend or what would you say does work that's not necessarily supplementing?
Yeah, so this is probably not going to get a lot of likes because it's something that I think most people have heard of before or, have read a lot about. And it really is sticking to the foundations of lifestyle behaviors that actually support good health.
Yeah.
And so, what I mean by that are things like eating well,
Mm,
moving your body, getting adequate sunlight exposure, lowering stress level, reducing overall toxin exposures. I mean, all of these things that support our overall health also do impact our sleep quality. And of course, I'm biased, but I truly believe that sleep is the foundation of our health. So, sleep is like step one, dial in your sleep, and that really influences all of these other areas of our health, right? But ultimately, everything kind of influences each other.
yeah.
So, all of those healthy lifestyle behaviors that we often hear about, diet and exercise, yes, those are so important, but sleep is right up there, if not the biggest thing that ultimately influences the choices you make when it comes to your nutrition. Also can influence how you might move your body or may not feel like you can move your body. It starts with sleep in terms of your overall sleep quality. So as far as the natural solutions and things that actually work, the best place to start, again, the foundations of activities, lifestyle behaviors, habits that really support overall health. But when it comes to sleep specifically, what's often referred to as healthy sleep hygiene behaviors are always going to be part of the foundations. And those are things like making sure that you have a consistent sleep schedule.
Mm,
So, ideally, going to bed around the same time, waking up at the same time across the week. That also includes um, limiting artificial blue light before bed, so minimizing or reducing screens before bed, not just because of the artificial blue light that can affect melatonin production, but also the stimulation aspect. Sometimes what we're doing on screens can also be very activating.
right.
So it's not just about the light, it's also the content that we're
What you're
consuming
consuming.
as well.
Yeah.
So that's a part of healthy sleep hygiene, and also things like don't eat too close to bed. We want, at least 3, 4 hours before bed between dinner or last meal and when we go to sleep, because otherwise our body's going to want to focus on digestion and we want our body to really just be focused on sleep. So that's important. And also, along those same lines, things like don't exercise too close to bed, especially if it's high
Ah,
intensity exercise that raises our core body temperature. And it may impact how our body then cools off and transitions to sleep. So, with any with dinner or activity, any of those behaviors, a good buffer zone of about 3, 4 hours is usually enough time to allow our bodies to transition to sleep. And then, of course, things like being mindful of caffeine intake, potentially cutting it off earlier in the day if you are someone who's very sensitive
that's all.
to the effects of caffeine. I know, right? Sometimes it's very much easier said than done. But stimulants, so caffeine, and of course, other substances like alcohol use and nicotine, those are all things ideally we want to move away from your actual bedtime just to give your body a chance to wind down, and also have enough time to metabolize or digest those things. So those would all fall under the umbrella of healthy sleep hygiene behaviors and things that often are all over social media or even Google. If you Google how to get better sleep, those are going to be those healthy sleep hygiene habits, which really are very important to our overall sleep quality. But what I will say is sometimes when sleep gets to a point where it's very disrupted or very fragmented, or even if you're having any difficulty actually falling asleep, getting back to sleep, or sleep is starting to really affect how you feel and function during your day,
Yeah.
when you might be actually dealing with a problem, a sleep problem, sometimes those healthy sleep hygiene habits aren't going to be enough. And that is because they're really important behaviors, but they help maintain good sleep if you already have good sleep.
Okay.
So the way that I like to uh, describe sleep hygiene, and this is actually something a former mentor shared with me, thinking about it just like dental hygiene. Do you
Okay.
go to your dentist, your dental hygienist, every 6 months or so to get a cleaning? And those cleanings help to maintain healthy gums, good oral hygiene. So, dental hygiene is all about maintenance. Same idea with sleep hygiene. It's all about maintaining good quality sleep if you already have good quality sleep. But if you are dealing with an actual problem, like insomnia, for example, or even sleep apnea, or some of the more common sleep disorders, you can't just see the dental hygienist. Like if you have a cavity, you have to see the dentist, right? So when we're dealing with an actual problem, we have to take things up a notch. And while sleep hygiene, again, is very important, it is all about the maintenance aspect. So when you have an actual sleep problem, seeing the specialist or the sleep dentist or the sleep doctor can actually help in terms of really trying to address the root cause and can also provide something that's going to be a little bit more effective than just sleep hygiene alone. And that is where something like cognitive behavior therapy for insomnia can be the next best step when someone is dealing with insomnia, for example, especially if they've tried all of those healthy sleep hygiene habits or behaviors and they just aren't moving the needle.
Yeah, and that makes sense. And I think that's a good analogy because when you do go to the dentist, right, you go for if you have a cavity, they'll fill it. But if you have root canal, they're like giving you the boot. They're like, here's your,
Mm-hmm.
we this is not our specialty. You got to take that to who really understands because it's deep. You got to pull out
Mm-hmm.
the roots. You have to understand the curvature even with the roots in the tooth. And I feel that that's perfect. I think that makes so
Yeah.
much sense with seeing a sleep specialist opposed to just going to a regular doctor and them saying, "Oh, well, try this. There you go. Maybe this will work. Maybe it won't."
Yeah. And unfortunately, most doctors, unless they specialize in sleep medicine, they actually don't know how to evaluate and treat sleep disorders. And
Right.
actually, Harvard published a study a couple of years ago showing that most medical schools don't have any sleep training. And if they do, it's maybe 1 or 2 hours during the entire medical school process.
That's
When
crazy.
sleep is so foundational to our health, most doctors aren't getting trained in sleep. So that's also a very big reason that most doctors won't ask you about your sleep, unless you bring it up sometimes. And why I always encourage folks to actually seek out a sleep specialist because, again, most doctors aren't going to be able to really provide the effective treatment that most people need. So looking a little bit beneath the surface is important.
Yeah, it's because it's so deeply rooted. Like it's going beyond the surface of really understanding how much it affects. Like one day you wake up and you're like, "Ugh, I don't feel good," and sometimes you can't shake it. Even if you have
Yeah.
the most positive outlook on life, you can't shake it sometimes. And it's because possibly the quality of sleep, and it's directly impacted,
Absolutely.
and you don't think about it. It just doesn't even it doesn't come up. It's just like I people don't go that far with it. But yeah,
Yeah. Well, I will say having a night or two here and there where you do experience that and wake up, feeling pretty crappy, cranky pants, that
yep,
is very normal and to be expected. But when it becomes a regular problem, when
right,
it's happening on a regular basis, majority of days per week, then that typically when I would say, you know what, let's start with sleep hygiene, trying out those healthy sleep habits. But if that's not enough and that's not really doing much, then let's definitely take
let's
things a
take it.
step further and let's actually get a sleep evaluation, see a sleep specialist, things of that nature.
Yeah, that makes sense. So now transitioning into sensory and behavioral science of sleep, the science behind it, directly connected to deep pressure stimulation,
Mhm.
weighted blankets. How do they influence the nervous system?
I think it's important to distinguish the different aspects of our nervous system that are at play when we are using something like a weighted blanket and really benefiting from that deep pressure stimulation. So, a quick science lesson, we have our autonomic nervous system, which branches off into our sympathetic nervous system and then our parasympathetic nervous system. Sympathetic is what's often referred to as that classic fight or flight response.
Right.
And our parasympathetic is our rest and digest process. And ideally, we want to be in that parasympathetic rest and digest state
Okay.
when we are getting to bed. And that's what makes sleep happen or unfold a lot easier when our mind and body feel that calm, that rest and digest. What a lot of people find is, especially in today's world, we're constantly in that sympathetic state, that chronic fight or flight. And that can sometimes be challenging in terms of reducing that overall level of fight or flight. But what we know in terms of relaxation and aromatherapy as well, but also deep pressure therapy with something like what a weighted blanket can provide, they directly influence our nervous system and promote more of that parasympathetic process, that rest and digest process, which is that state that we, again, want to be in when we're getting into bed. So, any time that we can promote that rest and digest, it communicates a sense of safety to our brain. And at the end of the day, our brain is always trying to make sure that we're surviving and alive. And so, we're all on a, very like basic level, we're always, looking for things that could be potentially dangerous or a threat to surviving, right? But anytime that we can promote a parasympathetic response with something that promotes that relaxation, that rest and digest, our brain gets those safety signals, which is what we want. Anytime we can tell our brain that we're safe, is I mean, it's so important that our brain gets those signals. Sometimes when people develop something like chronic insomnia, it's because ultimately their brain doesn't feel safe enough to get to sleep. So safety is a huge piece, and it ultimately influences what state of our nervous system we might be in. And interestingly, we cannot be in both a fight or flight state and a rest and digest state. We're either in one or the other. So we want to, what, and the way that I think about it is it's very much like a seesaw, and we want to like tip the seesaw to more of that rest and digest process. So with something like deep pressure stimulation, it can really tip that seesaw, promote more of that rest and digest, that parasympathetic response within our nervous system. And again, give our brain that safety signal, which is really important for good sleep quality. And I will also mention that anytime we have a sensory experience that really encompasses that deep pressure stimulation, like with what a weighted blanket can give us, we also are sending those safety signals to the brain. It's that gentle sensory feeling, that gentle pressure
Yeah.
that makes us feel on some level, almost like we're back in the womb, that we're being swaddled. So kind of brings us back to this childlike state. And all of that communicates a sense of safety. So it's very parasympathetic, promoting more of that rest and digest, which is ultimately helpful for every human on this planet.
Yeah, I agree. Feeling that sense of calm and safety, it you can't even really explain it. It just feels amazing. I mean, I don't know if like some people experience hugging someone who doesn't hug too well, opposed to someone it's like, oh,
Mm.
that hug was just amazing. The difference in just the way a hug feels and how you feel embraced and you feel at peace for that moment. So,
That's
yeah.
such a great example. Yes, the sensation of feeling that warm hug, feeling swaddled. Yes, those are all sensory experiences that ground us and that really communicate a sense of safety. So you're absolutely right. Like you can tell the difference between a really good bear hug and someone
Yeah,
who's, giving you the cold shoulder kind of
literally.
hug. Same kind of idea with, having a weighted blanket that can really promote that sense. It's almost like when you cover yourself with a weighted blanket, you're giving yourself a warm hug. You're telling your brain that you're safe. You're grounding yourself to the present moment. And then if that also incorporates aromatherapy, that's an added benefit as well, because that continues to tell your brain that you're safe. So you're giving your brain a lot of safety signals. And it's very much that feeling of, again, feeling warm, feeling supported, feeling grounded, feeling that sense of safety, and ultimately bringing your whole nervous system, your whole mind and body into more of that rest and digest calm state.
I love that. And I feel that's what we all yearn for, but sometimes just don't understand even where to begin. And so, for people who do have poor sleep habits that don't necessarily have a condition, do you think pairing deep pressure stimulation and aromatherapy could help reprogram the poor sleep habits with consistency, of course?
Absolutely. It's a really great way to communicate a sense of calm and relaxation before bed. It's such a great activity to do it as part of a wind down routine before bed. So, yes, I think in the same way that we can train ourselves to learn any new skill, just like training ourselves to learn a new language or to learn a new instrument. We can absolutely teach our brain how to learn new healthy skills as it pertains to relaxation before bed and ultimately that influencing our sleep quality. So yes, I think it's a really great place to start for anyone who is maybe starting to notice some changes to their sleep quality, and by incorporating those healthy sleep hygiene behaviors, that's such a great place to start. And trying all of these things out for at least a couple weeks, if not, a good month or so. You want to be consistent. You want to make sure that you're, really changing up your routine for a little bit. And then if after, I'd say a month or so, things aren't improving, then absolutely consider seeing a sleep specialist. But there are so many things that you can do as far as promoting that sense of relaxation and getting on the right track as far as healthy sleep habits. And those are a really great place to start is with the basics, with the foundations.
Right, natural ways to just test, hey, does this work or does this not work? So yeah, I think that's great advice. Now, to sleep myths and trends. What would you say is the most common sleep myth that needs to be put to rest?
The 8 hour myth is the most common sleep myth, which I mentioned a little bit earlier, but I'll just to emphasize there's no such thing as a magic number of sleep. So really the number that makes you feel your best during the day is the number that you want to shoot for. And so that's really important. It's not always about the number either. I know that there's so much emphasis on getting enough sleep, and yes, that's important. We also want to make sure that you're getting good quality sleep, that you're falling asleep within 15 to 20 minutes. That's kind of the ideal spot. And if you are waking up, that you're able to fall back to sleep quickly. So you don't want to have too much wakefulness during the night. We don't want your sleep fragmented or interrupted. And we also want your sleep to feel restorative overall. So the quality of your sleep is, in my opinion, very important, sometimes even more important than the actual number. And just along those lines, as an example, there's probably been nights where you got 8 hours of sleep, but that next day you felt terrible.
Oh yeah.
Or maybe some nights where you got 6 hours of sleep, but that next day you felt amazing.
Yes.
So again,
Yeah.
it isn't always about the number. So that's one of the biggest myths. And just to add on one more that I often hear about as well is that you can catch up on sleep.
Ah,
Absolutely not. I
okay.
wish, right? I think we all wish we could. Um, so we cannot catch up on sleep as much as maybe a lot of us try to catch up on the weekends.
Yeah.
It is a little bit different for kids and teens who are growing, but for adults, really, especially if you're losing a lot of sleep throughout the week, it's virtually impossible to make up for all of those lost hours. And over time, that of course can potentially lead to some negative health consequences, and most notably, like physical health in terms of heart issues, metabolic health, insulin, diabetes risk, and also cognitive brain health too. So certainly something to think about. And, inevitably as humans, we are all going to experience nights of sleep loss and maybe not getting enough sleep here and there. But we just don't want it to become a chronic problem because we just can't make up for years of lost sleep.
Right, and that makes sense. And in terms of just being aware that that is a possibility, not to stress, not to add it to a already full plate of daily stressors, but just to become aware and try to figure out ways naturally that help you not get back sleep, just gain the quality that you deserve.
Hmm.
That's
Absolutely.
yeah. Now, if you could give one piece of advice for better sleep tonight for anyone, what would you recommend?
I always like to say that good sleep begins in the morning. So, how
Mm,
you start your day is ultimately going to influence how you sleep the following night. So, one of the best things that you can do, and for most people, especially, I know it depends on the time of year and the season that we're in, but one of the best things that we can all do is get a bit of natural sunlight, ideally within the first 30 to 60 minutes after waking up. Morning sunshine is actually one of the most powerful ways to help regulate our sleep wake cycle. And in theory, if you can wake up at the same time each day, get your morning sunshine within that first hour or so after you wake up, your brain is going to get the right time signals from that morning sunshine. And that is ultimately going to help tell your brain what time you should be getting sleepy each night. So it's almost like working backwards. We want to start with how you wake up, what you do in the morning, and that is ultimately going to influence how you sleep the following night. So waking up at the same time, but I, even more so is ensuring that you're getting natural sunlight exposure as a way to help regulate your overall sleep-wake cycle.
Okay. Now, with the sunlight exposure, is it a certain time? Like, should you be out there for 5 minutes, 10 minutes, or up to 30? What's the time frame?
Yeah, so of course, always double check with your doctor as far as sun exposure goes. But when it comes to how much time, it's really, well, how much time do you have in the morning? I always like to be realistic as
Right.
well. So if it's 5 minutes, 5 minutes, get that 5 minutes. Um, Oddly enough, well, I should say, unfortunately, our windows inside the house, even if you have a lot of bright light, the glass actually blocks a lot of the benefits of the infrareds and other intensities of sunlight that our naked eyes can't see. So if you can open up a window in the house, you can get some of that natural light in. If you roll down your car windows, get that natural light in.
Yeah.
Those are some little like hacks, if you will. But ideally, it's how much time do you have in the morning, and however much time you do have, get what you can. I'd say typically if it's sunny out, 15, 20 minutes up to 30 minutes is usually sufficient from a sleep perspective. And what I also suggest is if you can, like take your breakfast outside or take your coffee, tea outside. So habit stack. Do things that you are doing in the morning, but take them outside if you can. And if not, like I said, open up the window or um, roll down the car windows so that you can get that natural light in.
Those are good tips, because that was going to be my next question. If someone, for whatever reason, just doesn't have the time, is there a way that you can just open a window and just let it, bask on your face? In terms of clouds, does that have any effect, or is it still
Cloud
sensitive?
cover.
Yeah.
Yeah. So even if it's cloudy or overcast, the natural light at that, even if it's, um, you know, even if it's gray and it doesn't seem like there is any sun there, that natural light is actually going to be more beneficial than, say, any indoor light or turning on any lights. So the intensity of light, even when it's cloudy, is still beneficial from a sleep perspective. So yes, even if it's cloudy, I would still suggest getting outside. And then if it, is overcast, sometimes spending a little bit more time outside can be helpful too, just to get um, the full benefits. But either way, natural light is always going to be the best thing to get in the morning because our eyes and our brain is most receptive to natural light. And even if we can't, see all of the many benefits of infrared and reds that the sun emits, our eyes are receiving those cues, and that's what's important from a sleep perspective. So really the takeaway is, regardless of how it looks outside, just get outside in the morning, get that natural sunlight, and that still is going to have a lot of amazing benefits on your sleep quality.
Yeah, that's amazing. And if you could pair it with some exercise, I can only imagine that's just extremely beneficial because when it's then time for sleep, you got the good stuff in the morning. Yeah,
Absolutely. Light and activity, two best things to stack together if you can.
love it. All right. Well, I this was amazing. There's so much information in here and
Yay.
the insight, everything was just amazing. Um, Thank you, first of all,
Well,
for taking
thank
the time
you.
to
No,
share.
thank you.
Yes, this is so insightful. Um, Now, in terms of where
Yeah.
people can find you, what channels and how can they connect directly with you?
Yeah, so I am at Dr. Sarah Sleep on all social platforms. I'm typically the most active on Instagram. So always happy to be a resource as well. The sleep community is actually very small, so chances are we know someone or know of someone. And so even if I personally can't help, I always try to connect folks to a local sleep specialist. So really, because the network is so small, um, there's actually, a few directories that basically can, um, well, they list the sleep specialists that are local or kind of in your state or area. So I'm
Oh,
always
that's
happy to share that with folks. And I can also share that with you as well, so that you can share it too. But I'm always happy to be a resource and connect folks to a sleep specialist if needed.
amazing. And that's great to know, because again, the whole sleep thing is seriously overlooked. And for people who really don't understand and have gotten possibly medications pushed on them because doctors sometimes just they don't it's not that they don't understand, they just don't specialize in it.
Yeah.
And just having the resources to reach out to someone like yourself is really great. And what you do is absolutely phenomenal.
Oh, thank you. I appreciate you saying that. And yeah, I think it's not doctors' faults either. I think it's the system, um, and it's their way of training, right? They learn to treat with medication, and not all doctors do that. But
Right.
I think it's important that if you are finding that you're just getting the option of medication, know that there are so many other evidence-based treatments out there that don't involve medication that are very much more holistic, natural solutions. And just because you get older doesn't mean that you're going to have sleep problems either. So that's also something I always like to tell folks. Like it's not a thing that we are all going to sleep poorly, as we get older. So in any case, if you're not sleeping well, start with the foundations. But if after a while you're not seeing much benefit, then it's definitely worth considering the next step in getting a sleep evaluation.
Yes, I love it. I agree. Everything you do is great. And if anyone is struggling
Yeah.
with sleep struggles, Dr. Sarah knows her stuff.
Oh, thank you. Thank you so much for having me. And I am so excited to try out Snuggle Sense. I can't wait.
I know, I'm so excited. I do feel this is going to be a game changer, but just have to get it out there, have to get it in everyone's hands because right now it's like, hear this, I hear that, and people need to see, need to feel, need to touch. So I'm super excited.
Me too. I'm so excited for you. And thank you again for having me on today. I
Yes.
appreciate it.